Welcome back to the Best PT Podcast. This is bonus episode 2, talking about temporomandibular disorders, or TMD. Beginning with the most common disorders of the TMJ, we have osteoarthritis, which occurs similar to all the other joints in the body. So in the TMJ joint, there is stiffness and a mild pain or aching that's worse upon waking in the morning that reduces throughout the day. Clicking in the TMJ is due to abnormal motion of the articular disc and the mandible, either anterior displacement or subluxation of the disc. Early clicks are a sign of a developing TMJ dysfunction. Late clicks are a sign of a chronic TMJ dysfunction. Reciprocal clicking occurs with both elevation and depression, and adhesive clicks occur due to teeth clenching, which is also called bruxism or excessive teeth clenching. TMJ cracking is more severe than clicking. It occurs when maximal range of motion of the articular disc occurs before the mandibular condyle translation finishes. So what happens is the condyle overrides the disc and you hear a very audible crack. TMJ locking. Closed locking occurs when the disc is dislocated without reduction, therefore jaw opening is limited. Open locking occurs when the joint subluxes or the disc is posteriorly displaced. So here you hear 2 clicks during depression and 2 during elevation, and sometimes the jaw is stuck completely open. Different types of bite patterns. Cross bite occurs when mandibular teeth are lateral to the maxillary teeth, so the bottom teeth are lateral to the top teeth. The teeth in this case can also be anterior or posterior. Underbite occurs when the mandibular teeth lie anterior to the maxillary teeth. This is also called buccoversion. And overbite occurs when the maxillary incisors extend anterior and inferior to the mandibular incisors. Some overbite, about 2 to 3 millimeters, is considered normal and is also called overjet. Jaw profiles. Orthognathic is a normal jaw profile. Retrognathic is a receding chin, and a prognathic is also called a strong jaw or strong chin. Deviations during depression. Tongue thrusting occurs when the tongue is used to create a mouth seal in order to swallow because the TMJ is dysfunctional. A C-curve depression is due to hypomobility of the TMJ, resulting in a swooping C shape towards the dysfunctional side that can be caused by a displaced disc or unilateral muscle hypomobility. An S-curve depression deviation occurs when muscular imbalance of the TMJ and or the medial disc is displaced, which causes a deviation towards the dysfunctional side. S-curves that occur early in opening are usually due to muscle spasm, and S-curves that occur late in jaw opening are usually due to capsulitis or tight capsule restriction. And finally, some special tests of the TMJ. We have the Javostek test. This occurs when you tap the parotid gland and you're observing for facial muscle twitching. A positive test is if you do see facial muscle twitching, and this indicates facial nerve pathology, so cranial nerve 7 pathology. The jaw reflex occurs by using a reflex hammer to tap your thumb over the patient's chin or tap a tongue depressor that is inside the patient's mouth. The normal result here is that the jaw automatically closes. TMJ auscultation, so using a stethoscope to listen to the TMJ, is very useful to understand exactly when clicks are occurring, and this helps you determine underlying disorders more easily. And finally, a few TMJ muscular pain referral patterns. If the masseter is involved, there's usually pain in the cheek and the mandible area to the forehead or ear. The temporalis referral pattern is the maxilla to the forehead or the temple region, so anterior and superior of the earlobe. Medial pterygoid referred pain usually occurs at the posterior mandible moving towards the TMJ. Lateral pterygoid occurs at the cheek moving posterior to the TMJ. Digastric muscular pain referral occurs with lateral cervical spine pain moving towards the posterior lateral skull, and occipitofrontal pain referral can occur above the eyes, on the eyelid, or in the region of the lateral skull. That's it for episode 2 of the bonus episodes talking about temporomandibular disorders. Bonus episode 3 will talk about the different types of breathing exercises. As always, the outline will be in the show notes. Thanks for joining me.